Once again, a very warm welcome on behalf of MIT. We're very much looking forward to supporting you with today's session D, which is Experiences in Campaign Integration. And we'd like to open with a few housekeeping notes before handing over to Gladys and Muhire. So we're delighted to offer today's session in English and French. You'll see on the Zoom menu bar the interpretation button. Please select your language now. And for the benefit of our French speakers who have already joined us, pour écouter la version française, il faut cliquer sur Interprétation dans les options de la réunion de Zoom et sélectionner le canal français. So thank you to our interpreters for your support today. Please be aware that the sessions will be recorded and you'll be able to view the recordings post-event via the Health Campaign Effectiveness Coalition website. And once again, we'd like to encourage interaction, so please use social media channels to promote and engage a wide audience this event by tagging @HCE Coalition and using the hashtag collaborative action. And during today's session, please add your questions to the Zoom Q&A, which can be found at the bottom of the Zoom screen. You'll be able to see the questions posted, upvote and add additional comments, as well as ask questions in English and French. And if you're not able to hear a question in another language, please ensure that you've selected your interpretation booth, because we will have our presenters speaking in both English and French today. And we'll aim to answer as many questions as possible during the session. Finally, the MIT team are here to help you with any technical difficulties. Please use the chat facility on Zoom or email the team at events@mit.uk.com. And I'm now delighted to hand over to Gladys to welcome you to the session. Thank you.
Thank you for joining session D on experience in campaign integration. I will start by introducing myself. My name is Muhire Gladys. I'm currently team lead for the health supply chain unit in the global supply chain team in CRS, and currently member of the campaign integration working group. In my role, I've been supporting the design and implementation of that campaign. And with the support from donors and collaboration with national stakeholders in 2020, CRS reached 74 million people in malaria projects in 12 countries, which to illustrate the magnitude of the health intervention, the reason why we are really interested in learning and sharing promising practices for health campaign effectiveness. And I'm really delighted and pleased to facilitate this session where we are going to learn how campaign integration is collaboratively planned. Campaign implementers will speak on key factors considered for successful integration, and participants will hear about the promising practice. We will hear from a campaign planning in Nepal for vitamin A supplementation and lymphatic filariasis, and also a campaign planning in Guinea for measles and meningitis A. We'll have two panelists from HIL in Nepal and FOSAD in Guinea. They are all part of the health campaign effectiveness program. Well, they are currently working on case study and the implementation research on collaborative planning. So the objective of our session will be to provide practical examples of cross-campaign collaboration after the decision to integrate has been made, and we are going to try to identify together promising practice and identify action the coalition can take to advance the topic in the next year. Before giving the floor to the panelists, I'm going to quickly go through, as it was presented in session A, to talk about the decision toolkit. I have to share my screen. Yes, please, Devi.
Gladys, I'm sorry, so sorry. We can't hear the French interpretation at the moment, and I've just reopened the room.
Okay.
We can't hear the French interpreter. I'm going to repeat that for the interpreters, just to make sure that we can get a quick test. So if I could just ask, let me just check.
Je vais revoir et
that'd be great. Thank you.
This is Sim in English.
So do you want me to start from where?
Okay, so I just want to double check that we have got Sim will be going first with the interpretation, if that's okay. I just want to double check that we've just got one of you speaking, if that's okay. I'm just going to test that again. Apologies. Okay, that feels like it's working. Sorry about that, Gladys, but I think we didn't have it working for a minute there. Thank you very much.
Okay. Thank you. So I was saying that I'm going to quickly remind the participants this session about the decision tool that was developed with the task force, with the Health Campaign Effectiveness Program. As it was presented in session A, it's a tool that will really guide you while you are making a decision to integrate health campaign. Devi, are you sharing the screen, the presentation, my presentation? Please?
Yes, that's right. Russell will share that. So all we need from you is a cue. Next slide.
Thank you.
Okay. Thank you.
Yes. Okay. So next slide, please. I will go quickly through the Appendix E, an overview. We know that there is, as I said earlier, there is a whole document that we want in this session to really emphasize or highlight Appendix D. Well, the program came up with a list of certain criteria that should be considering why we are having that discussion, why we are having that collaborative planning for organizing a mass campaign. So we have for health intervention, immunization, malaria, nutrition, and neglected disease. So they try to come up with very detailed and specific information required for those interventions, and they have provided information on the expected coverage based on WHO guidance, what are the seasonality of the disease. Next, please. For specific disease, for specific, we can see that it's well described for seasonal malaria chemoprophylaxis, for ITM. All those resources are really available to really guide the implementers, the national program that on a regular basis are organizing campaign, and also for implementers like our organization, Catholic Relief Services. So it's really a resources that we should really leverage on while we are reflecting on a collaborative process for our campaign, and while we are reflecting on integration. So on that appendix, you will find information on timing for campaign, what are the contraindications of medicine, what are the medicine that you can combine, what is required, what are the target group, what are the strategies should reflect on for that specific campaign, what are the geographic targets, what are the supply chain requirements, what are the information required for micro-planning. So all those elements are highlighted to guide your reflection. So those two are available and there for your use. Please get really, go visit the site and use those tools. And of course, with your inputs, the tool can be better improved to better serve and to ensure that we organize campaigns that are really integrated, if possible, or effective. Thank you. Next. So, as I said earlier, we are going to give the floor to our panelists. We have panelists who are Dr. Abdourahamane Diallo. He's currently a public health doctor with 4 years of experience in epidemiological research, immunization, and implementation of health campaign. He's currently in charge of research and epidemiological studies within the Center of Excellence for Training and Research on Malaria and Priority Disease in Guinea, FOSAD in French. We also have Dr. Sumitra. She's presently the technical team lead of the case study project presented by Field Group in Nepal. And she has more than 2-decade-long experience in the public health field. And she had a progressive career in the Ministry of Health and Population in Nepal. And last position was public health administrator. So join me welcoming our panelists. So why we welcome our panelists? We are going, we all know that integration of campaign, input, processes, and delivery mechanisms has been identified as a possible way to improve campaign effectiveness, equity, and efficiency. We are going to hear now from our two panelists who are going to give us two-country experience of collaborative planning of campaign integration. So we will start with Dr. Abdourahamane Diallo. He will present the experience in Guinea, and we are going to hear and learn from them how they practically integrated and conducted the collaborative planning in their country. So Dr. Abdourahamane Diallo, the floor is yours.
Merci Gladys.
Thank you, Gladys.
Bonsoir à tous.
Good evening, everyone. I'm Dr. Diallo. I'm project manager at the Center of Excellence for Training in Guinea, and I have the privilege of presenting a case study to you which concerns the improving the effectiveness of an integrated immunization campaign against the epidemic of meningitis A and measles through a collaborative process, a case study of potential integration in Guinea. Next slide, please. So what is the context? Guinea is in the meningitis belt of West Africa and is faced with numerous epidemics, including meningitis A and recurrent measles epidemics. In the same risk geographic area, measles co-appears with meningitis as a public health problem. And the World Health Organization has made recommendations and to organize a vaccination campaign with a follow-up of 3 months. So to consider, we will introduce the MENAFRVAC and the MEAS2 routine EPI. So the campaign of the MENAFRVAC is an opportunity to strengthen the efficiency and effectiveness of the campaign. This case study has the goal to document the collaborative planning of the integration of the two campaigns. So to carry out this study, we asked certain questions. And the principal research question was to know what the enabling factors and the barriers are at different levels of the health system that can have an effect on the effectiveness of the integrated campaign MENAFRVAC and measles in the context of COVID-19 in Guinea. And the secondary questions are, what are the most important stakeholders in the decision-making in the collaborative campaign? Second, what are the challenges and opportunities related to the collaborative micro-planning? And also, what are the advantages and disadvantages perceived by health workers and community leaders? Next slide, please. So, in order to conduct the study, we conducted a descriptive study. To collect the data, we conducted a desk review and conducted individual interviews with the stakeholders at the different levels, with the health authorities, the program officers, the technical and financial partners, the health district managers, the head of health centers, the community leaders, and the heads of households. So the approach that was used as observers, we participated in a different collaborative planning meetings, and we also participated in the technical meetings throughout the whole study period. We also conducted individual interviews at the central level and interviews of the health regional leaders and the district health managers at the region of Kankan. We also conducted interviews of the heads of health centers and households and community leaders. Next slide, please. So what you see here are images that show the region of Kankan, which is in the northeast of Guinea. Guinea is in West Africa. And you have some images that show the planning work that was conducted at the central level. And the image to the right on the top is a collaborative planning meeting for integrated vaccination campaign at the regional level. These are technical partners and healthcare partners. And then we have an image of the different activities that take place when the interviews were undertaken at the healthcare centers. Next slide.
Alors, quelles sont les parties prenantes qui ont été engagées dans ce processus? Donc, au niveau central, nous avons le ministère de la Santé, l'unité de coordination du ministère de la Santé qui appuie la mise en œuvre et la gestion des programmes, le programme élargi de vaccination, l'Agence nationale de la sécurité sanitaire, ainsi que ses partenaires tels que l'OMS et l'UNICEF. Donc, ceux-ci ont été impliqués par une participation aux réunions de coordination du PEV ainsi que les réunions techniques pour la planification de la campagne, incluant les partenaires de mise en œuvre. Donc, au niveau décentralisé, c'est-à-dire au niveau de la région et des districts sanitaires, ceux-ci ont été impliqués par des participations aux réunions de coordination virtuelles bi-hebdomadaires organisées avec les partenaires et les responsables des districts sanitaires pour discuter de la microplanification. Des équipes ont été déployées pour observer les réunions de microplanification, interviewer les acteurs de la santé au niveau régional et district sanitaire. Oui?
Est-ce que vous m'écoutez? C'est juste qu'on n'entend pas l'interprétation en anglais. Est-ce que vous pouvez, je vais vérifier 2 minutes, s'il vous plaît. Donc, si vous pouvez parler en français, je vais vérifier l'anglais. Okay, could we have a quick test, please, in the English booth?
On y va?
Yes, Amna's taken over for English.
Okay.
Yes, English.
D'accord.
So the actors that were involved in the community were a religious leader, community leaders, and leaders at different levels. And then we started having interviews to find what's the level of acceptability with regards to the integrated campaign. And we found different leaders, family leaders, etc. And next slide. Next slide, please. After this process, we found elements that were relevant, and we highlight here in the slides. The first element is an outcome that the collaborative planning allowed us to identify the stakeholders' concern and the bottlenecks about integrating the two, integrating both campaigns and find out what are the responsibility at all levels and propose mitigation measures. And we suggested changes in the health system, like new procedures that were not really mastered by the actors who are doing the implementation, and that could have a significant positive impact. And the planification, the collaborative planning is a crucial point that increases the success of the integrated campaign. campaign, and this worked very well in the study because the actors of both campaigns, they came from the same program, the enlarged vaccination campaign, and the things that are working for the meningitis and for measles. That was the purpose of the integrated campaign. So the effects that were of the vaccine that was affecting the acceptability of the vaccine. Next slide, please. After the study, we identified some practices that we list here in the study. The first one is using the intervention such as the vaccination that is accepted. So the integration platform facilitates like the buy-in from the community. So the vaccination is one of the campaigns, is the one the most solicited and most accepted. And because we know that measles and meningitis are seasonally recurring, and we started and this will increase the acceptability and the participation of the community. And the involvement of the early involvement of these actors also guarantees the success. And we privilege the campaign in the context of epidemics. So if in a context where there's more than one epidemic, that's an opportunity, and that's where we could integrate the intervention. So every visit to the community, there is a risk for the volunteers and for the actors. And we have also found that using video conferences and also for the monitoring, that actually helps the integration and the pre-planning and the preparation of the campaign. This looks like very promising. Next slide, please. After this process, we found challenges, the difficulties to block a realistic date for the integrated campaign. And when we started this case study, we have not the date for the implementation date of the campaign. So this is so all these efforts that were done in Guinea for the campaign to be possible, but we have not seen the campaign yet. And the new priorities from the government because of the COVID-19 and other epidemics. So in our context, we have seen various epidemics. We had Ebola, we had Diallo fever and Lassa fever. So that mixed up the priorities for the government with regards to the implementation of the campaign. And one of the challenges also is achieving high coverage from both the integrated campaign and from the introduction of the MEN-A into the routine of immunization services. So all of these challenges were we wanted to have the priority for the areas that most affected for the integrated campaign. So these partners, they had teams to prepare for the MEN-A, and then and to change with regards to the to encourage the people who are carrying out the vaccine and to encourage the acceptance of the vaccine. Next slide, please. I thank you. Thank you, Mr. Diallo, for your presentation.
Without further ado, I'm going to give the floor to Dr. Sumitra. She's going to present her project and also highlight what
Et aussi,
apologies, Gladys. We need to do a quick check over for the interpretation. So I'm just going to refresh that. So 1 second. Okay. 2 minutes. Give us a chance to get ourselves all set up, ready for Sumitra. 2 seconds.
This is the French channel. Le canal français. Le canal français semble marcher, non?
Oui,
très bien. Donc ça, c'est le canal français. Il semble que ma collègue n'est pas... Ah.
If we could just do another quick test. Apologies for this. So if I'm just going to send it to the French channel, you could do a test. If maybe Sim, if you could go next, that would be great.
I can't because I'm not assigned as an interpreter.
Okay. Just to say, I did hear both Sim and Emna at that moment. So let me just reset it again, maybe 2 seconds. Okay. Okay, I believe that should all be working. So I'm just going to just...
This is Sim on English channel. I think it works now.
Okay, so that's great. So I'll hand over to you, Dr. Sumitra. Sorry about this, Gladys. We'll move on as quickly as we can. Apologies. Okay.
It's okay, thank you. So, Dr. Sumitra, the floor is yours. And in your presentation, please make sure to highlight and to share with the participant the main obstacle and challenge encountered and how you address them, or what are the mitigation measures that you suggest. Thank you.
Thank you very much. Good morning, good afternoon, and good night, and namaste. I'm Sumitra Shrestha from Nepal. I'm presenting from the GREAT group about the collaborative case study and collaborative campaign planning, vitamin A supplementation and elimination of lymphatic filariasis in Nepal, prospect and channels for integration. Next slide, please. Next slide. The problems, the case study was started in the context of the problem was, despite of running lymphatic filariasis elimination campaign over 17 years, the elimination target is not met. So there is a question how to improve elite mass drug administration coverage. For this need better modality. And in the recently moved to the federal system, and now national health policy guided us to meet the national constitutional right of the health for all. We have to follow integrated health service, but however, there is no guideline and model for integration. So the quality. And within the countries, the call for the collaborative planning was taken as an opportunity to identify prospect, challenge, and next steps to assess the collaborative through the collaborative campaign approach and developing a viable co-delivery model. So it is to build evidence for promoting collaborative campaign to maximize campaign impact. Next slide, please. So we selected 2 campaigns for the collaboration. That was following the guideline, online guideline. We explored to identify fascinating factors, consulting with the project team and the concerning program region of SEAL. We selected lymphatic filariasis elimination campaign and vitamin A campaign, vitamin A supplementation campaign. So we, in this process, they developed the project plan and conceptual framework and taken approval by the CIWD, that is the Campaign Integration Working Group. And within the process of campaign planning, we also continuously monitor the progress, how far, meeting and interaction, observation, assessment, sharing these findings in the Campaign Integration Working Group, that's in the federal level, and in the study site municipality. And as directed by them, we updated data collection guidelines, develop IC matter level, and finally at final stage, within the as a reflective evaluation, we conducted the data collection. For this, we gave ethical clearance from the Nepal Health Research Council, and we collected data using the multi-method qualitative study design. For official stakeholders, we take data, collect the data by conducting key interviews for the female community health volunteers, focus group discussion, and with the community people in-depth interview. Collect the next slide, please. Our finding was pre-planning meetings with concerned division of SEAL acted as icebreaker, because these campaigns have been running over years vertically. So the pre-planning meetings provided avenue to communication, open communication and discussion, and it gives up to find a pros and cons that by collaborative campaign there is more benefits. So this set the formal process for project approval, endorsement of the campaign integration working group, and that's it for meeting process. And the pre-planning meetings are also very important for rescheduling of the campaign date. Within the COVID, subject to COVID, there were delays. So getting this information and this understanding, the research campaign within the LA campaigns set for the 2 to 13, from 2nd to 13 April, and within 5 days difference, there was vitamin A campaign. And we introduced one intervention as a co-delivery. We coined it as a complementary monitoring and supervision approach. In this, FC female community health volunteers in their house-to-house visit for the vitamin A supplementation campaign, save the campaign information, both campaign reassessed as the LF campaign was completed few days ago. They reassessed whether they have taken medication, LF medication in the house. If anybody had missed in their query, they reinforce for intaking the LF medication and refer to nearby health facility, recorded who they have referred and reported to the health facility and facility. The other findings, the positive outcome of this intervention co-delivery was 67 individuals undertook lymphatic filariasis medicine against LF visiting health facility in the month of the Baisakh. That is while there was vitamin campaign was ongoing. And next step, finding of the collaborative campaign processes from the program regions come to the conclusion that, well, collaborative campaign planning is good and there is the prospects. So let's have a seat together and assess the study findings on possibility of this campus integration. So one thing and another is, since this study was done in a municipality, so there is feeling of need of representative study for better understanding. Next slide. Yes, in this study we faced some expected and unexpected. One was the delay, as everybody knows. There was a COVID-related delays, and another one as the officer was busy with this COVID vaccination, and there was postponement delays and changes in the government official. So to mitigate, we will keep on working while further getting the official letter, and research LF campaign is taken as an avenue to introduce campaign collaborative monitoring and supervision approach and contributed. The one problem was we could not get this all officials at a meeting. So continued communication either while one or other official using the electronic media, and the unexpected circumstances as we take as an opportunity to learn and be flexible. So another unexpected finding was misconception as one of the major reasons behind non-compliance to the LF elimination medication, and observed children having difficulty swallowing medication. So to mitigate, we developed local culture sensitive elimination campaigns message. And our question to we found that swallowing medication was problem for the was a problem, and stated that there is stated the findings the campaign integration working group meeting and municipality, and also stated the same guideline for safe medication by the WHO. Next slide, please. Formation of campaign integration working group found working group in which consent program divisions, director and focal person along with the nominees of the project team provided a forum for collaborative planning process. So it was very effective. And the other promising practice is introduction of exercise during health worker orientation, because in this included potential area. We asked the question about potential of integration by the between two campaigns by components, not 12 components. We found it is effective to sensitize the health workers about the importance and possible areas by the component and getting their perspective at once, whether possible or not possible. Finally, complementary monitoring and supervision approach as a co-delivery found promising, because existing local health service providers, mainly female community health volunteers, could be mobilized by short orientation, and they have acceptance for this approach on the one hand. On the other hand, the community has trust for them. For example, enforcement by the female community health volunteers and family reporter as the reason behind individuals undertaking LF medication by visiting health facilities in the month of vitamin A. Next slide, please. So the sampling, this is the focus group discussion with the female community volunteers at the end of the taking their perspective. And next picture is clearly reading the poster posted in the health post. Next, please. And we engaged 3 key stakeholders during the collaborative campaign process. One at the program level is during pre-planning meetings, and program level is immunology and disease control division, which is responsible for lymphatic filariasis elimination campaigns. Family welfare division for the launching the vitamin A supplementation campaign, and LED is logistic management division. So, and the second is local governments, province and municipality by the interaction meetings, micro planning of the field activities with the municipality, with the health official approval by meeting, jointly conducting orientation and monitoring registry testing, setting findings and forthcoming meetings. And finally, community level, the health workers and female community health volunteers and individuals included the former health service provided by the orientation, follow-up visits and the collected data from female community volunteers and individuals during at the last phase of data collection. Next. Thank you very much.
Thank you, Dr. Sumitra, for your presentation. I would like to ask you what was the impact of the collaborative planning process on outcomes, such as coverage, equity, efficiency, safety, cost, sustainability, and health system, and also intersectoral linkages. Could you share your perspective?
First, equity. It improved the equity because in this study we found that mobile population, absentee population are one of the hard to reach because during the campaign time, they are out of the study site due to for the educational reason or for the economic reason. So during the following month, during the vitamin A campaign, when the FCSU went to their home and asked about whether they have taken LF medication in the period, they said no, because they were out of the study site. So these, in total of 69 people, later went to the health facilities and get medication. So it improved the equity because these people were not in this during the campaign site, but later they went. And the other point is the people, from the beginning, in the municipality, they are concerned about a lot of people, about 32 to 33% people being out of the study site. And they are coming back during the festival. We have just finished the big festival called Dasai. And because the campaign, LF campaign is only in the 10 districts out of the total 77 districts that a lot of people miss. So how these people, because they are coming back for the festival, because how we can provide them, they will get infected. So considering this reality, this time municipality has planned, said that, okay, we will try to provide them by our discretion and providing stocking the medicine and health facilities for health facility, providing these absentees when coming back home. So these are, yes, it increases equity, and so also the effectiveness because within the short orientation program, because they can monitor and refer to the health for the medication. So yes, it improves the equity and cross-section integration as well. This program goes side by side.
Gladys, you're on mute at the minute. If you could just put your microphone on.
Thank you so much, Dr. Sumitra, for sharing Nepal experience. Unfortunately, we are running out of time, and there are two good questions that we have in our chat, but we are going to ask, instead of answering the question, we are going to quickly give the floor to Mackenzie. And if we manage to gain some time, we'll come back to the question. So Dr. Sumitra and Dr. Diallo, please check the answer so that by the time we came back, you can quickly answer the two questions that are in the chat. So Mackenzie, the floor is yours, please.
Thank you so much. Okay. My name is Mackenzie Manny. I work with a Seattle-based data analytics firm called Linksbridge. And I hope to just take 2 minutes here today to briefly introduce an online interactive campaign integration tool that we've been working on over the last few months to complement the decision toolkit. Next slide, please. So in 2018, Linksbridge started working with global health partners to collect campaign data and create a large centralized database. We use that database to create campaign visualizations and calendars to help improve the availability of campaign data. Next slide. So over the last several months, we have worked to develop a prototype interactive campaign integration tool to allow users to view upcoming or historical campaigns in our database, and also analyze alignment between campaigns to decide if they might be candidates for integration. Next slide. So early interviews with campaign implementers from all sectors helped us understand what users might need in a tool, and also informed the initial direction of the prototype. Next slide. So we're now looking for more interested users to test the tool and give us feedback about how to make it as useful as possible for those who are making decisions about campaign integration. So we'd like to extend an invitation to anyone who wants to learn more to join our networking session starting in just a few moments here, or send us an email at hce@linksbridge.com to get a link for the tool and set up some time with us for a feedback session. Thank you.
Thank you so much, Mackenzie, for using 2 minutes. And I hope that everyone did understand her requests to have some participants who will express their interest in being part of the pilot. So we are going to quickly ask Dr. Diallo to respond to David's question in 1 minute. I'm going to quickly translate the question to you, Dr. Diallo. Vous avez mentionné que
so this is for Dr. Diallo. You mentioned that the adverse effects have been identified. So how did the program address this problem so that better implement? We know that you didn't implement it yet, but what is the feedback that you've gotten so far? Thank you for the question, and thank you for passing the floor to me. So concerning the fear on the secondary effects of the 2 vaccines, the community reported that if they'd accepted these 2 vaccines, and if a child took the 2 vaccines and could not identify which vaccine would be the source of the secondary effects. So is it the 2 vaccines or is it an individual vaccine? So the fear concerns the meningitis vaccine because this is a new vaccine, while the measles vaccine is something that's accepted by the community. So the broaden program, which will implement this campaign, will be based on the communications and the strengthening of the engagement that we will undertake in order to face this challenge. Thank you for sharing this information.
The comment that the program is working on sensitization to ensure that people are more comfortable for that new vaccine. I'm going to ask Dr. Sumitra to quickly respond to the question raised by David. Thanks for the question. how did the volunteers, the community volunteer, react to the idea of integration? Did they express concern about the increased training and time needed to facilitate and monitoring the progress in implementing true intervention at the household level? Please use 1 minute to respond to the question. Thank you.
They delivered the information and follow up, but they feel it was little bit difficulty for them. Because need to give information and access for the board program, board campaign, becoming the difference of target age group, because they are for the children and other for the big population. So a bit feel difficulty, and and they accept it, but feel a little bit difficulty as well.
Okay. Thank you so much, Dr. Sumitra. One of the objectives of our session was to identify some of the action the coalition should focus on in fiscal year 2022. Unfortunately, we are running short of time, but we really encourage all the participants to put in the chat or to share their reflection on what should be the accent or the area where the coalition or the task force should focus for this fiscal year and for ensuring more collaborative planning in health campaign. In order to quickly conclude this call, we have seen that from those two presentations that one of the key elements, one of the promising practice is to really establish a collaboration mechanism with national entity. And secondly is to have really a template that can guide us while we are doing planning to identify key elements that are needed in the planning, and also to do some complementary monitoring and supervision approach using the technology. So I will stop there, and thanks everyone for joining the call. We had so many things to discuss. Unfortunately, time is not on our side. So I will give the floor to Devi.
Thank you, Gladys. I know time has run away with us today, so just a big thank you on behalf of us all. Excuse me 1 second. Let me just. Okay, so thank you on behalf of the NYT events team. It has been our pleasure to support you today. As Chris mentioned in our opening plenary, let me just, apologies 1 second. So we're going to join at our next networking session. So we'll be using AirMeet as the Coalition's annual meeting networking platform. So if you could click on the network session from the program tab on the platform, that will then take you to the page where you can set up your AirMeet account to join, and it only takes a couple of minutes. So you know, do go ahead and do that. You'll then be able to go onto AirMeet and you'll be able to join the conversations on the tables. So they will all be set up ready for you, and you can just go and find a free chair around a table to join in the conversation. There's a time now for a very short break actually, because the networking session will go live in about 3 minutes. And also just to say that tomorrow when we open day 2, there's another AirMeet session, and that's at 0700 EDT, before the actual breakout sessions begin at 8 o'clock EDT. So big thank you once again to all of our speakers and Gladys as well today. So thank you all for joining us. I will now end the meeting. Thank you.